Every evening around the same time, you look down. The ankles are puffy. The sock line is still there, pressed into the skin an hour after the socks came off. The shoes that fit fine this morning feel like they belong to a slightly smaller person by early afternoon. And you have been managing this the same way for months. Less salt, feet up, compression socks from the pharmacy, patience, and the swelling keeps coming back. Every evening. Like a tide that knows your schedule. I need to tell you something that changes this conversation entirely. Evening ankle swelling in seniors is not a single condition. It is a symptom, and it can come from 6 different directions, each with a different mechanism, different implications, and a different urgency. Most seniors have been given one explanation: salt, or age, or just how things are, when the explanation sitting beneath their swollen ankles may be something very different, something treatable, something that in some cases requires attention sooner than the next routine appointment. I'm Dr. Eleanor Bennett. Subscribe to this channel before we continue, because what I am going to tell you is not about frightening you every time your ankles feel heavy. It is about giving you the clinical vocabulary to describe what you are experiencing accurately, so that the right cause gets identified and the right response gets made. Let me start with the most important principle. Not all ankle swelling is the same, and the differences between types tell you most of what you need to know about urgency and cause. Press your finger firmly into the swollen area into the front of the ankle or the shin just above it. Hold for 5 seconds. Release. If the indentation stays, if the tissue does not spring back immediately, but remains dented for several seconds, that is called pitting edema. It means fluid has accumulated in the tissue spaces and is moving under pressure. If the skin springs back immediately with no persistent indentation, the swelling has a different texture and a different likely cause. The presence, depth, and distribution of pitting edema tells a clinical story. Deep pitting that takes a long time to refill suggests significant fluid accumulation. Pitting confined to the ankle and lower leg suggests one set of causes. Pitting that extends above the knee, or that is accompanied by abdominal swelling, suggests a more systemic cause. Swelling that is identical in both legs suggests a systemic or central cause. Swelling that is significantly worse in one leg than the other adds another category of concern entirely, including the possibility of a deep vein thrombosis, a blood clot in the deep veins of the leg, which can produce sudden unilateral swelling with warmth and tenderness, and which is a medical emergency requiring immediate evaluation. One-sided swelling that arrives suddenly, particularly in a leg that was previously normal, should not be attributed to any of the 6 causes I am about to describe. It should be evaluated urgently, because a clot that forms in the deep leg veins can travel to the lungs and become a life-threatening pulmonary embolism. This is the cause that overrides all others on urgency. Sudden, unilateral, warm, tender swelling means call for evaluation today, not at the next scheduled appointment. This is the first conversation most seniors have never had about their ankle swelling, not because it is complicated, but because 15 minutes in a checkup does not allow for the systematic evaluation that this symptom deserves. Let me take you through the 6 causes, not in order of frequency, in order of urgency. Cause number 1, heart failure. I am starting here not because heart failure is the most common cause of ankle swelling in seniors. It is not. But because it is the one that most urgently cannot wait, and the one most often confused with the others. In heart failure, the heart's pumping capacity is reduced. It cannot move blood forward through the circulation with the efficiency it once could. Blood backs up. Pressure rises in the venous system. Fluid leaks from the congested vessels into the surrounding tissues. The ankles swell, the legs feel heavy, and in more advanced cases, fluid accumulates in the lungs, producing the breathlessness on exertion, the difficulty lying flat, the waking in the night needing to sit up to breathe, that are the hallmarks of cardiac congestion. What distinguishes heart failure swelling from the others? Several things. It tends to be bilateral, both ankles, both legs, equally and symmetrically. It is often accompanied by fatigue that goes beyond the ordinary tiredness of a busy day. It may be accompanied by breathlessness, walking upstairs, carrying groceries, walking from the car park that seems disproportionate to the effort involved. It may worsen with lying flat and improve somewhat when elevated, and it often involves a rapid weight gain, 2, 3, or more pounds over a few days from the accumulating fluid before the swelling becomes visible. None of these features means heart failure is definitely present. All of them mean it needs to be ruled out quickly, with the appropriate tests before any other explanation is accepted. Margaret was 74, active for her age, managing her blood pressure and going about her life without obvious cardiac symptoms. Her ankles had been swelling every evening for about 8 weeks. She had reduced her sodium intake. She had elevated her legs. The swelling persisted. She noticed she was more breathless than usual, climbing the stairs to her bedroom, but attributed it to the extra weight she had gained, not realizing that the extra weight was the fluid accumulating in her body and not fat from her diet. Her general practitioner, at a routine visit, noticed the pitting edema, heard a finding in her lungs, and sent her for an echocardiogram the same day. Her heart function was significantly reduced. She had heart failure that had been developing silently for months, while the ankle swelling was attributed to age and salt. Treatment was started immediately. Her condition stabilized. But the 8 weeks during which the swelling had been managed with dietary changes rather than investigated were 8 weeks of unrecognized cardiac decompensation. The lesson is not that every swollen ankle is heart failure. The lesson is that heart failure must be considered first and excluded with evidence before accepting a more benign explanation. Cause number 2. Venous insufficiency. This is the most common cause of evening ankle swelling in seniors and the one most consistently unnamed and unexplained in routine care. The veins in the lower legs are equipped with one-way valves that prevent blood from flowing backward as it makes its way upward against gravity toward the heart. With age, these valves weaken. They become less competent. Blood pools in the lower legs when standing or sitting for prolonged periods. The increased venous pressure causes fluid to leak into the surrounding tissue. By evening, after a full day upright, that pooling has accumulated into the visible swelling that marks the end of every day. Venous insufficiency swelling has a characteristic pattern that distinguishes it from cardiac and kidney causes. It is typically worse after prolonged standing or sitting, and improves significantly overnight when the legs are elevated. It is often accompanied by a heaviness or aching in the lower legs. Not pain, but a fatigue in the tissue that makes the legs feel weighted. The skin over chronically congested veins may become discolored brownish or coppery, a finding called hemosiderin staining. And in long-standing venous insufficiency, the skin can thicken and harden in the lower leg, a process that increases infection risk significantly. What venous insufficiency does not typically cause, and this is a distinguishing feature, is breathlessness, rapid weight gain, or swelling that extends significantly above the knee. When present in isolation, with the characteristic daily pattern, and without cardiac or systemic symptoms, venous insufficiency is a manageable condition, but managed correctly, with graduated compression, with leg elevation strategies, with physical activity that engages the calf muscle pump not by reducing salt and hoping. Let me tell you about Eleanor. Eleanor was 71, retired, spending much of her day at her desk working on her memoirs. Her ankles swelled every afternoon, reliably starting around 3 o'clock, they improved overnight. She felt no breathlessness, no weight gain, no symptoms beyond the heaviness itself. Her doctor had told her it was age and mentioned salt reduction. Eleanor had been cutting salt for a year with no effect on the swelling. When venous insufficiency was properly identified through a duplex ultrasound of the leg veins, the valvular incompetence was clear. Graduated compression stockings fitted correctly to the right pressure level, combined with a deliberate practice of walking 30 minutes each morning to engage the calf muscle pump before the swelling began accumulating, changed her afternoons significantly within 3 weeks. The swelling did not disappear entirely. Venous insufficiency is managed, not cured, but it was reduced to a level that no longer affected her footwear choices or her evenings. She had been reducing salt for a year for a condition that had nothing to do with salt. Cause number 3, kidney disease. The kidneys regulate fluid balance. They manage the level of albumin, a protein that keeps fluid inside blood vessels, by either retaining or losing it. In kidney disease, albumin can leak into the urine rather than staying in the circulation where it belongs. As albumin levels fall, the osmotic pressure that holds fluid inside blood vessels decreases. Fluid leaks from the bloodstream into tissues throughout the body, including the ankles and lower legs. Kidney-related swelling tends to be softer and more generalized than cardiac swelling. It may affect the face, particularly around the eyes in the morning, as well as the lower limbs. It is typically accompanied by other signs of kidney dysfunction: foamy or frothy urine, reduced urine output, fatigue, loss of appetite. And it is detectable through blood and urine tests that are straightforward and widely available. The reason kidney-related swelling is missed is the same reason so many kidney problems are missed in seniors. The symptoms are nonspecific, the condition progresses slowly, and the tests that would reveal it are not always ordered in the context of an ankle swelling complaint. Robert was 69, on lisinopril for blood pressure, and had developed bilateral ankle swelling over a period of approximately 6 months. He noticed his urine had become foamy. He mentioned it to his wife, who thought nothing of it. He had not mentioned it to his doctor because it did not feel like a symptom. When a comprehensive metabolic panel revealed significantly reduced kidney function and a urine test showed heavy protein loss, the picture of kidney-mediated fluid accumulation became clear. The foamy urine, which he had almost not mentioned, was the protein escaping from damaged glomeruli. The ankle swelling was the consequence of falling albumin, and both had been present for months before anyone connected them. Cause number 4, medication effects. I have covered this in depth in other videos, particularly regarding amlodipine, but in the context of ankle swelling causes, it belongs on this list explicitly because medication-related swelling is frequently managed as if it were dietary, when the correct response is a clinical conversation about the medication. Calcium channel blockers, amlodipine being the most common cause ankle swelling through the mechanism of arterial dilation that exceeds venous dilation, creating a pressure gradient in the lower leg that drives fluid into the tissue. Other medications associated with ankle swelling include certain diabetes medications, NSAIDs taken regularly, some antidepressants, and corticosteroids. Each has a different mechanism and a different management approach. All of them share the feature that reducing salt will not fix what a medication is causing. The key question when ankle swelling develops in a senior on multiple medications is, what changed in the past 3 to 6 months? A new medication, a dose increase, or the addition of an interacting substance may be the explanation, and identifying it allows for a targeted response, rather than years of dietary restriction that addresses the wrong cause. Cause number 5, thyroid disease. Hypothyroidism, an underactive thyroid, is one of the most commonly misdiagnoses in seniors over 65. It is estimated that subclinical hypothyroidism affects a significant proportion of older adults, many of whom are unaware of it. And one of its effects, the accumulation of a specific type of fluid in tissues called myxedema, produces swelling that does not pit in the typical way, because the fluid is protein-rich and more viscous than the simple fluid of cardiac or venous edema. Thyroid-related swelling tends to affect the lower legs and may also produce a characteristic fullness in the face and around the eyes. It comes with other hypothyroid symptoms: unusual cold sensitivity, fatigue that exceeds what other causes explain, constipation, dry skin, thinning hair, and a mental slowness that may have been attributed to aging. A simple TSH blood test reveals it. And once identified and treated with thyroid replacement therapy, the swelling resolves as thyroid function normalizes. The thyroid is often the last thing checked when a senior presents with ankle swelling, fatigue, and gradual weight gain, even when the clinical picture is consistent with hypothyroidism, because the presentation is nonspecific enough to be absorbed by the other explanations on this list. Vivian was 68. With ankle swelling, unusual fatigue, and a cold sensitivity that had worsened over the past year. She was on no medications associated with swelling. Her cardiac function was normal. Her kidneys were functioning well. Venous insufficiency was mild and insufficient to explain the degree of swelling. When her TSH was finally checked, it was significantly elevated, indicating substantial underactive thyroid function. Thyroid replacement therapy was started. Over 3 months, the swelling resolved, the fatigue improved, and the cold sensitivity, which she had attributed to getting older and had stopped mentioning, disappeared. She had been attributing thyroid disease to age for the better part of a year. Cause number 6, lymphatic dysfunction. The lymphatic system runs alongside the venous system as a parallel drainage network, collecting the fluid that leaks from blood vessels into tissue spaces and returning it to the circulation. When the lymphatic system is compromised through prior infection, through cancer treatment, through physical damage to lymph nodes, or through the natural changes that can occur with aging fluid accumulates in the tissue in a pattern called lymphedema. Lymphedema produces a swelling that is typically firmer than venous or cardiac edema. It tends not to pit as readily. It may affect one limb more than the other, particularly when the cause is localized lymph node damage. It does not fluctuate dramatically with elevation. Unlike venous insufficiency, the improvement with overnight leg raising is often incomplete, and it is a progressive condition that worsens without appropriate management that is specific to lymphedema and entirely different from what is appropriate for any other cause on this list. A senior who has had breast cancer treatment, including lymph node removal or radiation, should consider lymphedema when lower limb swelling develops, not only upper limb swelling as is more commonly discussed. A senior with a history of recurrent leg cellulitis skin infections of the lower leg may have developed lymphatic damage from those repeated infections. And a senior with no obvious history, but swelling that is asymmetric, firm, and poorly responsive to elevation deserves a lymphatic evaluation before accepting any other diagnosis. So how do you use all of this practically? Because this video is not designed to make you a diagnostician. It is designed to make you a more precise reporter. When you describe your ankle swelling to your doctor, describe more than the swelling. Describe when it starts each day, whether it is equally present in both legs, whether pressing on it leaves an indentation, whether you have gained weight in the past few weeks without changing your diet, whether you feel breathless on exertion in a way that has changed, whether your urine has looked different, whether you have noticed cold sensitivity, unusual fatigue, or changes in your skin or hair, whether you have had any infections in the lower legs, any cancer treatment, any lymph node removal at any point. That description specific, systematic, connected, transforms an ankle swelling complaint into a clinical picture. It gives your doctor the information needed to order the right tests, rule out the causes that cannot wait, and identify the cause that actually explains what your ankles have been trying to tell you every evening. Because they have been telling you something, not about salt, not about age, about a specific identifiable process happening in your body that has a name, a mechanism, and a management approach, and in many cases, a path to meaningful improvement that you have not yet been offered because the right conversation has not yet been had. You have been told it is one of those things. It is not one of those things. It is one of 6 things. And now you know what questions to ask to find out which one. Share this with someone who has been told their ankle swelling is just age. Subscribe to this channel, and I will see you in the next video.